think under this government what we've seen is a huge reorganisation of the NHS, and swathes of the NHS now sold off to private enterprise, and everybody I speak to is incredibly concerned about that. The reason that we've seen that change is because this government put in place the biggest top-down reorganisation of the NHS that we've ever seen, and they did that despite both the parties, both Nick Clegg and David Cameron, promising not to reorganise the NHS, not to change things around at all. And as I say, we've seen the biggest reorganisation in the NHS's history. So it's a frightening time for the NHS, the people that rely on NHS services, and the staff that work in the service too.
How will it affect the people who rely on the NHS quite a lot?
Well, what we've seen is waiting lists going up, levels of service going down, and morale in the NHS falling through the floor. And that last point is, I think, incredibly important, because you can't have a good service without good staff. We've seen frontline levels of care reduce significantly, so 9,000 fewer nurses, for instance, in the NHS, because so much money is being drawn out of the service in order to pay for this top-down reorganisation. So the reorganisation cost £3 billion. And what that's been spent on is completely reorganising a number of services, but also competition regulation within the NHS, which is causing huge problems and uncertainty. And we recently saw a privatised hospital then going back to the state and saying that they couldn't run the services anymore because they were too expensive. So it causes huge uncertainty and worse levels of care. And nobody wants to see that, and yet this government have done it over the tops of the people that voted for them.
And what will it mean for the staff of the NHS as well?
Well, let's say morale is absolutely rock bottom. Every single member of staff in the NHS that I speak to, and I speak to a number, is incredibly concerned by the future of the service, what they're being asked to do, often sort of 3 jobs. Where previously they had a number of colleagues and staff who would help them on the ward. Levels of staffing on wards are skyrocketing in terms of the patient ratio. There's not enough nurses to patients, and that's a real problem. And in terms of the future of staff, they are being asked to change their contracts. They're being tupied over to new contracts, and they have a great level of uncertainty, and good staff are leaving, and when good staff leave, levels of service decline.
At the moment, does it look like Cameron will use his veto powers to stop the American trade deal?
No, not at all. I mean, this government have already said that they will continue with TTIP. TTIP is an invention that they have supported entirely, and the NHS, if we're not careful and TTIP does come into force, will govern a lot of what goes on in the NHS and cement the privatisation that we've seen. That's why the Labour Party is committed to taking TTIP out of the NHS and making sure that services are delivered through the public sector, not the private sector as we've seen under this government.